Welcome everyone to our web seminar, Mitigating Risks of Non-Digital Study Reporting Processes. I'm very delighted to welcome you to our web seminar today. So my name is Franziska Rakitin. I am Customer Engagement Manager at UpToData, and I have the honor of moderating today's online seminar. Our speaker, Norbert, is Managing Director at UpToData and a recognized expert in the field of automated report generation in the regulated field. He will provide you with valuable insights and will be happy to answer your questions. Together, we represent UpToData, a small company that is located in Wörstadt in Germany, with further sites in USA and Asia. UpToData is specialized in implementing automated lab processes for regulatory data management. For 30 years, our goal has been to extend lab digitization by overcoming the common lab data silos, implement secure and automated data transfer processes, and eliminate any manual data transfer activities. So let us have a quick look at what the next 30 minutes will hold for you. We will not only look into non-digital reporting processes to create study reports, but also present the risks of non-digital reporting processes and the strategies for mitigating those risks. Please feel free to use the chat to ask questions. It's the chat with a little question mark down below in the menu here. Mark that your post questions are anonymous. So thank you for being here today. I hope you have an exciting and informative time. And I now hand over to Norbert.
Yeah, thanks, Franziska. So I'm happy that you're all here now today for a short discussion on non-digital reporting processes to create study reports. Technical things, nice. Not continuing. Yeah, here we are. Okay, so talking about a non-digital reporting process is not just one thing, and you know, it's a comparably long journey from the very beginning of a study or the first information you get when you talk about the study to the final report. And what I want to give you is a short overview and a short glance of how we envision or how we see that process. So as we understand, the whole processing of data on the CRO or a smaller lab or a lab at a sponsor site basically starts when samples are being announced. So there will be samples coming in. There might be contracts before that in place, but the main thing that is coming up and that is telling you that there will be some work for you and for a lab to do is basically the sample manifest that will be sent by the clinic or by the organization that is handling your samples as a middleman. But that's basically, that manifest is sent to you as, I don't know, for example, PDF. So that is typically, and even when you have electronic systems, this is a non-automated process. So you'll receive a sheet with information, and of course a few days, weeks, depending on how the study is set up, you will receive the samples. Sample will come in, and whenever you receive the samples, there will be records created on your end, even with a sample manifest. So the PDF document you receive is a document, is a record in that sense, because it's providing you with information about the study. The same thing when you receive the samples, you will create, and you have to create records to be able to track all these samples that come to your site. So you have to have knowledge on the package ID itself. When was the package received? The samples that have been in the package, the condition of the samples in the package, and so forth. So and you know better than me what all has to be done. But you have to be aware that all of these things, all of these processes create records. create records, and not just one record. There might be multiple. So when you're looking, for example, in sample inventory is something where you store your samples, of course, the study samples, but there's not only study samples in there. There's also material in the sample inventory, and material is taking a broader role now, since the agency is requiring you to also provide information about the material you received, when it was received, and so forth. So all these things that are stored in an inventory also create records in your system. Then, of course, you prepare the samples, and then it's getting really complicated when you mix up the samples you received in the package with some raw material, reference standards. You create standard samples, you create standards QCs. all of these things have to be created following SOPs, and when you look at these processes, you realize that a lot of things being created, and it's of course the same with the sample, with a plate. When you start creating a plate, you have your standards in your company, how plate designs typically look like. You place samples on the plate. You might either create a sequence file, or you do that interactively on your plate reader. It depends on how you're equipped, whatever is in there. The measurement, of course, is creating the raw data. There will be either chromatograms or any other way of storing that information. And what I describe here is not just for LCMS. It's basically the same thing with small variations. If you do large molecules, LBA studies, if you're doing immunogenicity studies or ADA studies, the whole process basically is the same. And what you get here is a whole bunch of records that at the end will end up somewhere as electronic documents. And we are talking about non-digital reporting processes. That means in the worst case, everything that I was just talking about is on paper. And I hope there's nobody in that audience that is simply using paper to document all these processes. So if it's a better and a much more convenient way to storing all these things in Excel sheets, but still with Excel sheets you have a lot of things, even though there are a lot of problems, even though they are digital process already. So to finish that and to come to the point where we come into place today is the result reporting. So what you do, and you're also well aware of that, you have these Excel sheets, you have your Word templates, and that might be, and you have to create these documents. So that's something where you transfer data from sample receipt sheets, from the sample preparation sheets, from inventory, when did we receive the samples, how long were they stored. All these things now need to be transferred to the Word document. And of course, when you're a CRO, you typically have a data transfer agreement with your sponsor, which means you also have to create another sheet, another tabulation of data, where you merge information from different processes. So you might merge information from the measurement with the information from the sample manifest. So telling you what was the demographics of the sample that was measured, what is the result of the sample, and that all needs to go to the DTA file. So that is the whole process. And when you look at these things, where are the risks? There are so many. I just put a few of them. Of course, using Excel sheets, or when you're using paper sheets, that's even worse. But using Excel sheets, they are complex. You have to have forms. You have to have all your data in these sheets. For the processing, sometimes data needs to be transferred from sheet to sheet. Yeah, the samples that have been received or samples that were announced in the manifest needs to be tabulated in another sheet that's potentially creating a sequence file. So all that data then is residing in these sheets, and if you really want to report something instantaneously, that's almost not possible. Someone has to sit down and combine and compile information into new documents. So that is a very complex process, keeping track of all these data. Of course, there is a whole lot of lack of integrity, data integrity. There is no closed system. Even if you have a validated Excel sheet. That's not a guarantee for the data integrity. You have to be careful about when you think about rounding decimal places and sig figs in Excel. Excel is a very tricky software when it comes to this kind of calculation or doing calculation in Excel sheets. And of course, you can't do really comprehensive evaluation across runs, and if you want to do that, once again, someone had to sit down and combine all these things. And as I'm talking, it's obvious that the whole process is very time consuming. You have to have manually create the reports, you have to transfer data manual. That means somehow there might be transcription errors, there might be transfer errors, creating graphs and things like that makes life even more complex. And when you think about the the templates that might come from your sponsors, they make life much easier and much more complex, because the requirements might be completely different. So what can you do to mitigate the risk? Basically, what is being told by everyone who's in charge of data integrity, they will tell you, okay, there are two options to do that. Either you do fix and forget, means every time you do something, you have to have a procedure in place that tells you, okay, if you transfer data from A to B, make sure that the data is transferred, do a review to detect if there's something wrong. Yeah, so that's the procedural way. A better way, and that's of course why we are talking about today, is you should move to a technical solution, and that's basically also what the regulators are telling you. You should implement data governance as part of your quality system, technical or procedural, but basically based on that risk-based approach, you have to understand the risks of your processes, and then you have to assess and remediate your risk of data integrity. So it means you have to really look at where are sheets, where are paper, how do I make sure that the data that's sitting on that sitting at a certain spot is really the original data, can't be changed, and if they are changed, there is an audit record created, and all the requirements that come from data integrity requirements. And even the regulators, if you read the documents when you read the documents I'm pointing you to later on, they tell you go the way with a technical solution, increase your business efficiency with implementing technical solutions, not with a go and forget with paper on paper. Why do I mention ICH M10 now? ICH M10 is one thing that is discussed very intensely and is also implemented already in most companies. I just want to highlight if you have not looked at the guideline, you will see that there is a section now in the guideline telling you these records you have to keep. Of course, that's something that they're really stating now in the document, and you see that's page 34. So you have to have documentation on site, and there are explicit requirements of what needs to be recorded, what is minimum data that you need to have recorded, either in paper or, as I said, in Excel sheets or whatever system you're using. That is something that you need. And also there are now requirements on what needs to be in the report itself. So there is requirement on that. There needs to be, for every reference done, there needs to be a copy of the COA. Or something equivalent as part of that report, if it's a bioanalytical study, a bioanalytical report. And for all of these topics that you see on the left-hand side, all of these records basically that you have to keep, these records are now referenced, and of course now they are explicitly part of a regulatory document and GLP relevant. So even if you had a more relaxed look at the data before, which I doubt, but today it's really saying, okay, the handling of the blank matrix, how was the blank matrix created, where did you receive it from, how long was it in your storage, that needs to be in a 21 CFR 11 compliant way handled, either as said electronically or as in paper form. That's not a decision that you need to have electronic things, but it's a good way to do. And if you want to get a glimpse of how the current look and the current guidelines on data integrity are about, I recommend the WHO Annex 4 guideline. It's basically the latest and I won't say the greatest, but it's a combination of everything that's out in the market and been discussed. And the agencies, the European and the American agencies now more and more referring to these WHO Annex 4 guideline. So that is really a comprehensive document. Take a look at it. It's only 20-page document. It gives you a very comprehensive look at it, and you can see how to go there. Okay, so that's basically the thing when you handle data either in paper form, but we don't talk about paper anymore. If you have Excel sheets or any other kind of records saved, how can you make sure that that the guidelines and the guidelines on data integrity can be ensured? And as said, the agencies are I'm telling you, you should introduce an electronic system to do that. And if you don't want to introduce LIMS or anything else, one easy way of doing that would be introducing a version control software, basically a document management. And there is one thing out there that you potentially already are using that might be it's SharePoint, Microsoft SharePoint, or it's part now of Microsoft 365. Even if you don't know it, this software is now when you've licensed. If you're using Teams, for example, you're using Outlook, most likely you have Microsoft SharePoint in house, and you will be able to leverage that software. There are measures in SharePoint that can help you to enable a version controlling. For example, folders can be, of course, it's like a folder structure in your workstation. You can create folder structures in SharePoint. You can co-author documents. You can have access controls to library, what's called a library, to basically the whole thing, to folders within a library, files. That's one thing where you really can have access controls. You can also track activity. So what you see on the right-hand side here is a configuration screen of SharePoint where you see its version control. So you can enable for a library, you can enable that the documents saved to a folder. Basically, literally, when you save it to a folder, that file will be version controlled. So there will be a new version created for whenever you save that document. And of course, it's not just that you have a version control. You can also have a kind of audit trail. That's called a version history. So this tool can kind of help you to go the next step in leveraging data integrity when you don't want to introduce an electronic system that is a closed system and helps you. That's the pro of the software. The thing that comes with it, you have to take care of qualifying that environment. It's a SaaS solution that brings new requirements for you when it comes to backup, when it comes to availability, when it comes to long-term storage. So these all are things you have to think about. And I don't want to go into very much detail here, but if you really want to consider this and see how you can leverage that, even maybe for a time, to bridge the gap until you have an electronic system implemented, have a look at that document. It's basically a description how GXP guidelines can be implemented and what things you have to do and you have to follow when you want to implement a version control system using SharePoint. So SharePoint is one solution that you might already have in place, but it's, as said, it's brings another level of complexity because of that qualified environment and a lot of things you have to take care of. So having a SaaS solution, of course, that would be easier when someone else would take care of the lower part, when someone is taking care of that, and that brings us to the solution we've created over the last 2 years, and I was talking about on the EBF last year and the year before. So when you look at these pillars of work that you do, we started basically with an application that we call StudyGen 360 Reporter Bioanalytics. It's a SaaS solution that helps you create the final report, or the main goal, the whole thing cares about creating the report. And of course, for that we need to be able to get to data. That's why we are also managing the raw data in this case. So we want to ensure and have a closed system. We want to ensure data integrity, means we are not loading, or at least not by default, we are not loading CSV files, because they can be changed. What we want to have from you is basically the raw data file, and then we are extracting the data from the raw data file into our report. And of course, since we discussed that already, ICH M10, and we're providing the ICH M10 compliant report, we give you the opportunities to document things that are necessary for the reporting, when it comes to sample preparation. So means what reference standard you needed, you have used, what are the critical reagents. So that's all part of that solution, and it's a SaaS solution, fully qualified. It can be rolled out with a minimum effort to you, and it helps you to create that report and reduce the amount of time dramatically. And what we're currently working on is so to say the overall bioanalytical process when it comes to handling these samples. But what we want to care about, and that's the solution we're currently developing, and that will be available this year, is lab sample bioanalytics. Means we are handling metadata, and I've given you some idea of what we mean by metadata. We're handling the life cycle of these documents. We're handling version control and all of the requirements for data integrity and GLP compliance in that software. And we have a direct interfacing to these devices to then, of course, create the result report again. So that's the whole solution we are going to provide in 2024, giving you the ability to document all the necessary steps you are doing in your lab with a SaaS solution, which has almost no only little effort to introduce. Of course, there are things you have to do when it comes to your validation master plan and things like that. But we're giving you a whole bunch of documents that help you in introducing this kind of software. So that's two examples of what you should do and how you could solve that. The issues that come with manual reporting processes and processing of study data in a manual way. So basically, the advice is get rid of the manual way, introduce an electronic system as the regulator tell you, and make use of software like our software to let that process be a more smooth process in your company.